Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional. Our organization has over 103 partners across the country who are dedicated to patient education, advocacy, and finding ways to better access health and disease resources for African Americans. This broadcast of African American Health Matters is one of the health outreach tools used to reach millions. Thanks to Cyberstation USA, and thanks to you for tuning in.
African American Health Matters is a new mobile health text message and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. Our website, www.africanamericanhealthmatters.com, has updates and information about diseases, tips, audio messages, and later this year, video slices of doctors talking about critical diseases that affect African Americans.
Over the past few weeks, we've interviewed physicians about a number of diseases and health matters that relate to our health and discussed how various diseases and health issues specifically affect African Americans. There's so much information we've gotten from our physicians. We want to thank them for taking the time to educate us about African American health matters. This week we want to start wrapping up some of our previous interviews, so for this show, we're going to have a full half hour of doctors we've talked to in the past, continuing their discussions about various diseases.
Dr. Alfiee Breland-Noble is a professor and director of Department of Psychiatry and Behavioral Science at Duke University Medical Center. She's going to be talking to us about depression, bipolar disorder, dementia, and Alzheimer's disease.
We're talking with Dr. Noble, and we're discussing depression and why families suffer without seeking help.
Anger in men. We see the back and forth attitudes of our women. We see the overweight and the sleep apnea and all of these things. And we just sometimes classify it as cultural and it just accept it as being that. But it is not just a cultural thing.
That's right. It is not limited to one culture. Like I said, I think the cultural aspects of it really have to do with how it is manifested within a particular culture and how people respond to it. Those, I think, are the culturally embedded pieces. But, the diseases are the diseases, and they're not going to look drastically different from one culture to another. We just have different ways, I think, culturally of responding to what the experience is
the fact that some of the messages and the doctor observations is not only just for African Americans, but it's for many cultures, and ours is unique to us, and that's why we talk about that. Let's move on into dementia and Alzheimer's. We'll kind of pull those together. Is that okay? How does one or the other? Who's the boss in dementia and Alzheimer's? I mean, my father had Alzheimer's before he passed, and dementia, I think, presented itself. How do we know what's happening?
So dementia, when we think about dementia as a term, dementia is a term that describes loss of memory and changes or reductions in other mental abilities that are severe enough that, again, they impact the person's day-to-day functioning. And it really is, this is something that occurs in the brain. These are changes in your brain. And so under the umbrella of dementia, the most common form is Alzheimer's disease. So if you look at things like the Alzheimer's Association, what they share with us is that Alzheimer's disease is the most common form of dementia, and it accounts for a significant portion of the dementia cases. So there are other types of dementia, and we just want to acknowledge that Alzheimer's disease is one of those, and it is probably, if not the most common, one of the most common.
Okay, I was not aware as an individual that Alzheimer's was a part of dementia. I see it. That's something I didn't know. What are some of the symptoms associated with Alzheimer's?
Sure. So, they're the obvious ones. That's loss of memory, and it's loss of memory of many different facets of your memory. So it's losing things like, as you said, you had this experience. I had the experience as well. Not being able to remember from one moment to the next what one has done. Not being able to remember faces and names. Just forgetting things that one might think, how do you say it, are a part of normal life. So it might even be things like forgetting how to dress yourself.
That's right.
These are, the memory loss of one experience is so significant that it begins to disrupt the person's daily life. So again, you might confuse things. You might get confused about where you are from one moment to the next. You might lose your words. You're in the middle of a sentence and you forget how to get to the end of the sentence. You forget your train of thought. Understanding visual relationships or spatial relationships with visual images. So how far is it really from where I'm sitting in this car to that stop sign? How am I to this curb? Just not having the ability to maintain and manage all of that information. And I think two others that are very common are losing things. Or you start out to go retrieve something, and then this happens to a lot of us, so I don't want to...
You're right about that.
You know, you start out in the kitchen, you say, okay, I run upstairs and get my magazine, and you get halfway up the steps, and you think, wait a minute, where did I go?
What was I going up here for?
But it's not that. I do that all the time. But,
I do too.
That kind of thing happening all the time on a regular and consistent basis. And decrease their poor judgment. So, you things that you would normally think not to do, that rationality part of you, or that rational part of you, sometimes with Alzheimer's, it can just leave you. And you don't recognize it. It's probably not safe to be walking around outside in the middle of a snowstorm. Just thinking about, we just had a snowstorm here. So those are the kinds of things you want to look at. And then as these things happen, as the person begins to experience these types of things, it can then lead to other problems like depression. Because if you can't remember from one moment to the next what you're doing, that loss of functioning, that can be really hurtful for people. And so they start to withdraw. So those are some of the things you want to be paying attention to as it relates to Alzheimer's.
And I've also noticed that this normally occurs in senior citizens.
Yes.
But is it not true that it's also occurring in younger people nowadays as well?
Oh, absolutely. We do there is information, there's data out there that talks about early onset Alzheimer's. So we had a family member, she was like a family member, she's a church member, where her Alzheimer's onset was at the age of 50. Now that's less common, but it absolutely is something that is happening. That, younger and younger people are experiencing what they call early onset Alzheimer's.
And also, sometimes a family member showing early signs of Alzheimer's, it can be a hard fact to face nowadays, too.
Oh, absolutely. And one of the most interesting things about it is the earlier people can get treated. Now, of course, we know there's no cure, but you can help to delay some of the deterioration that occurs with the person. There are medications that are available. There are different kinds of activities a person can do. Like one of the things that a lot of psychiatrists, geriatric psychiatrists will do with patients who are experiencing Alzheimer's is teach them activities that they can do to strengthen their minds. But you're absolutely right. When people start to fear that is what's happening to them or a family member, particularly for those of us in the African American community, it can be a really bitter pill to swallow. And it can be really difficult to encourage that person to go and seek help, because we keep thinking things like, oh, it's just a temporary lapse. It's really not Alzheimer's.
Absolutely.
And it's going to get better. And what we do in delaying treatment, I think, is we deprive ourselves of the opportunities of all these new advances available to help us.
Okay. So I've also heard that certain things like Sudoku, crossword puzzles, etc., if you start doing those at an early age, they also help to offset Alzheimer's later on in life.
Absolutely. So the more that you can engage your brain and use, because we only use a very small portion of our brain over the lifetime, our brain capacity. But the more that you can begin, it's almost like working a muscle. You strengthen the muscle early, you delay the possibility, or you prepare yourself. It's almost like you build an armor to help yourself when these kinds of diseases or illnesses begin to attack. So if you work and train your brain early, it can be helpful in the long term in terms of delaying the onset of dementia and Alzheimer's.
Are there any at-home self-care things that can happen? I had read somewhere where with regular checks by a local relative or friend, sometimes they can be able to live without constant supervision. I mean, we're surrounded by people who have parents who are moving into Alzheimer's, and it's just so very difficult when a mother or father or sister or brother is going through this.
But the absolute best thing we can do is get the person in front of a clinician.
There you go.
Who can help them. And so the two main approaches, as we talk about mental health issues, are generally going to be the drug treatments, the medication treatments, and then the non-drug or behavioral, in this case, since we're talking about the brain, cognitive types of treatments. And so getting the person in, I think one of the most important things is getting the diagnosis.
There you go. And at what point let's back up a step. At what point we're seeing these things happening to our relative or friend. At what point do we get them to check it out?
All right, so this is something that's personal for me because we went through this experience with my grandfather, my mother's father. And I think when you really have to trust your instincts as a family member. And we know as African Americans, we really believe in the spiritual.
Yeah.
We believe in, your body telling you when you need to do something. We believe in that intuition. And so at the first inkling that there's something really wrong, I think that's the point at which we need to just pull the family member aside and say, look, I will go with you, but I would like us to go at least talk to a professional so we can get a sense of what's going on. So what one might do is, when you go to your primary care physician, you can begin to talk with that person about, okay, here's my family member's experience. I'm not really sure what's going on, but can you help us? Can you give us some type of test? Can you give us just some type of screen where we can begin to consider if this is something we need to be worried about? And then I think beyond that, once you have a diagnosis, then you know what to do. But if you don't have a diagnosis, then how do you know how to help the person? Because you don't know what you're dealing with until you get that label, until you get somebody who says, well, maybe it's not today, but let's look at family history. Where there are other people in your family who experience Alzheimer's. And we know that African Americans in particular are at increased risk. So Latinos as well. And so doing that family background, forcing us to talk about what's going on in our families so that we can get a sense of, is this something that I may be impacted by?
Right.
I think that's one of the best things that we can do. But getting in front of the professional, getting the diagnosis so that you know exactly what it is that you're dealing with, so that you know whether or not you're dealing with Alzheimer's or a different type of dementia, because different types of dementia are going to require different treatments.
Colon cancer. Each year, close to 150,000 people are diagnosed with it, and 50,000 people die from it. It's the disease no one wants to talk about. But when faced with such alarming statistics, isn't it time we did? The fact is, colon cancer is the second leading cause of cancer deaths in the United States, but it can be prevented if caught early. Colon cancer prevention starts with you. Learn the risk factors, recognize the symptoms, know your family history, and understand your screening options. This is a cancer you have the power to do something about by getting your colon checked. A screening test, such as a colonoscopy, can reduce your risk of developing colon cancer by up to 80%. Getting a screening test gives you the chance to detect colon cancer early, before it's serious. For most people, screening should start at the age of 50, but doctors recommend that African Americans start earlier. African Americans are far more likely to develop colon cancer, so getting tested needs to take place when you're 45. And if you have a family history of the disease, make sure you tell your doctor you may need to be screened even earlier. Again, you can do something about colon cancer. Since 1999, the Colon Cancer Alliance has made it its mission to increase awareness of colon cancer by developing a variety of local and national programs to help educate the public about the disease. Whether it's fighting on the steps of the nation's capital to ensure health plans cover screening, or holding free educational seminars to provide support for those diagnosed with the disease, the Colon Cancer Alliance takes pride in finding new ways to raise awareness. Educating you about screening tests, supporting patients and families dealing with the disease, and reducing colon cancer rates through events held in cities throughout the U.S. are just a few of the Colon Cancer Alliance's many efforts. And it's working. Because of the work of organizations like the Colon Cancer Alliance, people are starting to talk about the disease, and that's what it's all about. Talking is the first step to making colon cancer a thing of the past. Remember, you have the power to do something about colon cancer. Talk to your doctor. Reduce your risk. Find out more about colon cancer and screening options by visiting the Colon Cancer Alliance at www.screenmycolon.org. That's www.screenmycolon.org. Or call 877-422-2030 for more information.
We had a conversation with Dr. Angela Hill. She's a pharmacist and a consultant pharmacist and has been for the last 18 years. She's a professor, administrator, and a clinician who specializes in psychiatric and neurologic disorders, geriatrics, alternative medicine, and pharmacy communications at Florida A&M University, pharmacy at Tallahassee, Florida. Dr. Hill was very informative with regard to remembering to take medications. Many of our subscribers has asked for monthly tips to remember to take their medication, and here's what she had to say.
We'll hear more from Dr. Hill in the future, but in this part of the interview, Dr. Hill discusses generic medications. These are medications that you can get over the counter at other times. If they're prescription, you can save money by getting the generic brand rather than the brand name. For example, omeprazole is a generic brand related to gastric conditions like acid reflux and gastritis. But you can also get the brand name Prilosec over the counter in the pretty containers and pay more. Let's hear what Dr. Hill says about generic medications. We hear a lot about generic medications. Can you tell us the biggest difference in brand name and generic medications?
Well, the biggest thing is this, and I like to use this analogy. If you were to buy a sneaker, we have a store here called Payless. I don't know if you've
Yeah, we've got it here.
Okay.
Mm-hmm.
So some people, would go to Payless, and some people say, I would rather go to Reebok to get my sneakers.
Mm-hmm. Yeah, that's true.
or Foot Locker, or
Yeah.
things like that. Mm-hmm. Well, what has happened is Foot Locker has paid more money to, sell their shoe, and they may be investing a little bit more in advertising to things like the coloring that makes the shoe black or
Mm-hmm.
white or whatever. They may spend a little bit more in shoelaces. Well, the same thing happens with medications. The active ingredient is the same. It has to go through testing, but what the manufacturers do to save money is that they don't spend as much maybe on the coloring that makes the tablet look pink.
I see.
And the other fillers, or what we call excipients, the things that may give the tablet that bulk, they may cut a little corner there, but they have to prove that even in cutting those corners, that the drug will dissolve the same, it should start working within the same period, and ultimately that patient would have a very, very similar clinical experience.
So it has to be basically equivalent to the brand name.
Yes. So they are rated. They are what we call A, B, C, and even D rated. Mm-hmm. And typically your chains like CVS, Walgreens, they are by law required to only buy A, B generic equivalent drugs, so that the consumer isn't compromised on that end. Now, where the consumer comes into danger is when they take a risk and buy things like online, where it's leased as stringently. But most times when you go in your mainstream pharmacy, they're getting AB rated generics. So the consumer is getting as close to the real thing as possible.
Speaking of that, it's sometimes, I know I've had a situation where a doctor has given me a prescription. I've taken it to the drugstore. Let's say it costs $50, $100, and the pharmacist says, why didn't your doctor prescribe the generic version? Can we actually ask the doctor or the pharmacist to give us the generic version of that, or does the doctor have to prescribe it himself?
Yeah, you can always ask. What typically happens in the world of insurances is that the insurances prefer that you use
Yes.
a generic equivalent. But some medications don't have a generic equivalent for a while. What has happened is they get a patent to pretty much market that drug as Lipitor for a certain number of years. It's usually around 7. And nobody else can make that drug that has that common ingredient in it until after that patent expires.
Right.
Once it expires, then what that means is that company X, Y, and Z can make their version of Lipitor in the generic name, and then by default, when the prescription comes to the pharmacy, if there is a generic available, it will be filled in the generic, so the consumer doesn't really have to ask for it. Typically what happens when patients ask for anything is that they request brand only.
For cost, sometimes it comes down, and I was under the impression that if you had a brand that had a generic version of it, that the doctor had to actually prescribe the generic, that you couldn't take that brand prescription to the pharmacist and say, do you have a generic version of this?
Oh, no. They could write either generic or brand, and the pharmacist by default will go for, again, the cheaper equivalent.
Okay.
But it's just the problem comes in is that everything won't always have a generic available, and you do that first 5 to 7 year window. But you don't have to, the consumer doesn't have to take on that responsibility of asking for the generic, nor does the doctor have to always remember it. That's just a process of handling and preparing medications that we do by default. But again, the insurance companies are what dictate that. So, but the patient can always request to make sure this is generic, and we indicate that typically on the label of the medication as well.
Problems with bladder control?
To control the urge to rush to the toilet, learn to do a pelvic muscle contraction. Walk calmly and slowly to the bathroom. Cut out caffeine, alcohol, and sweetness. To control frequency at night, reduce evening fluids. Prop up your feet during the day. Have your prostate checked for enlargement and consider medications if it is.
Call 1-800-BLADDER for more tips and details.
Have you ever had a discussion with your healthcare professional about your weight and health? According to the Centers for Disease Control and Prevention, 68% of U.S. adults are affected by excess weight or obesity. In an effort to raise awareness of excess weight and its impact on an individual's health, the Obesity Action Coalition, a registered 501c3 national nonprofit, has launched the Your Weight Matters campaign to challenge all Americans to talk to a healthcare professional about their weight and health. Individuals affected by excess weight are at a much greater risk of developing serious health conditions such as diabetes, hypertension, sleep apnea, and more. To take the Your Weight Matters campaign challenge today, visit the campaign website located at www.yourweightmatters.org. Here you will find a wide variety of weight and health-related information to help you assess your weight. Campaign participants also receive an e-toolkit, which is designed to help them prepare for their visit with their healthcare professional. The kit also includes a food diary, health and wellness tips, and much more. Isn't it time you started thinking about how your weight affects your health? Take the Your Weight Matters campaign challenge today at www.yourweightmatters.org. The Your Weight Matters campaign challenge is brought to you by the Obesity Action Coalition. The Obesity Action Coalition is the only nonprofit whose sole focus is representing those affected by obesity through education, advocacy, and support. The OAC offers many valuable educational resources on obesity, morbid obesity, childhood obesity, treatment options, and much more. For more information about the Your Weight Matters campaign, visit www.yourweightmatters.org or call 800-717-3117.
Each week, we bring you tips from our African American Health Matters mobile health text message service. So here's some for this week.
Here's one on asthma control. Living successfully with asthma means controlling your environment, close monitoring with peak flow meter, and a strict treatment plan.
And here was our inspirational message. Loving myself heals my life. Every cell of my body vibrates with energy and health as I nourish my mind, body, and soul.
Here's a tip titled Metabolic Syndrome. Diabetes, a condition characterized by elevated glucose levels, high triglycerides, low HDL cholesterol, high blood pressure, and obesity. See a doctor. www.johnshopkinshealthalerts.com.
Hypertension. Recent research suggests reducing salt can save lives and may lower blood pressure as effectively as increasing medication. Another one of our favorites from the Johns Hopkins Health Alert.
Here's one on arthritis. Make sure you get enough sleep, focus on the good, stand up straight, keep a journal, conservative footwear, watch your carbs and alcohol.
We hope through this broadcast and our website, you'll sign on to get health tips over your cell phone. The subscription is free and you can opt out or cancel at any time. So stay on top of your health matters by continuing to tune into this show as we build on Cyberstation USA.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000.
Think you're addicted to food? You may be right. Researchers from Yale University wanted to know if some people's brains react differently to food, the way substance abusers' brains react to drugs. First, they asked 48 young women to answer a questionnaire to determine if they had symptoms of addictive-like eating behavior. Then they hooked the women up to a machine that measured their brain activity while they tasted either a chocolate milkshake or a liquid with no flavor. Women who scored higher on the food addiction quiz had more activity in certain regions of their brain when they were expecting food. These regions play a role in urging us to eat and are the same parts that motivate people with substance dependence to use drugs. People with higher food addiction scores also had less activity in certain areas that help put on the brakes after a tasty treat. According to the researchers, food advertising could make it hard for some people to stick to a healthy eating plan because of the way their brains respond to the ads. I'm Dr. Cindy Haynes of Health Day TV with the news that doctors are reading, health news that matters to you.
Be sure to tune in on Fridays, noon to 1 for African American Health Matters on Cyberstation USA.